Although all my patients and their stories are memorable, good and bad, there are 3 patients that have truly impacted me during my career and during the COVID pandemic. One patient in particular had a profound positive impact on me. When I came into work, I was told I was going to ICU to train and to get comfortable with the potential of having an acute ventilated patient. I think I speak for most of my colleagues. This was a scary thought. I swallowed my pride and walked into a world of unknown. When I walked into my patient's room, I was faced with a maze of IV lines, tubes, and wires. I took a minute to observe my situation. My patient was young and had so much life left to live. That's a moment when I realized how fragile life truly can be. A few days later, I had heard the great news of him being extubated, and he was coming to MP1 PCU. I walked into his room and I told him how wonderful he looked. I think I almost cried when he told me that he had talked to his wife and children for the first time in almost 2 weeks. I told him I had the pleasure of taking care of him when he was in ICU, and his response was one I will always remember. He said, "I know, I remember you and you talking with me." These are things we often look past. Patients may not be awake, but they're always there and they're always listening to what we have to say. I made sure to check on him every day until the day that he left. I think that was the most gratifying discharge I have ever had. As nurses, we have the great pleasure of being with patients and families through some of their best times, but we also have to be with them through some of their worst. Most people probably remember this story from my Nurses Week video, but it still makes a huge impact on me daily when I walk into work. Every day we're told we shouldn't be spending a lot of time in these patients' rooms, which goes against everything we were ever taught. What started out to be a normal day turned into one of the hardest shifts of my career. I spent at least 6 of my 8-hour shift in with this patient. Limiting exposure was not an option. She screamed for help whenever someone was not with her, often searching air to breathe and anxious for what was to come. Her family wanted everything and anything to be done within the realms of her DNR/DNI order. But what the family didn't know is that she was already getting everything she could medically. What she really needed was comfort and peace. I sat with her for hours, telling her that everything was going to be okay, holding her hand until she finally fell asleep. She was one of those patients that I couldn't stop thinking about when I went home that night. And I came in the next morning and my worst fears had been realized. Her condition had only worsened. Her family still requesting to do everything and anything. They even considered changing her code status. What they didn't know is that it was already too late, and the patient herself was suffering. I will never get the image of her gasping for breath out of my head, and as her family contemplated what the next steps were. Minutes felt like hours, but what felt like an eternity watching this patient struggle, the patient was finally made a CMO, and she was getting the comfort she finally deserved. I couldn't help but cry as her family called her to say their last words to her, and her granddaughter telling her that she was the best grandmother that she could have ever asked for. I sat with her during some of her final moments, just so she knew she wasn't alone, and she could be at peace, and that's what she did. She passed peacefully with staff by her side. There are highs and lows in every shift, some we control, and some we can never see coming. I will mostly remember the panic and fear within my coworker's eyes. She had already spent most of her shift in this particular patient's room. She came out to the nurse's station and said, "Can you page the doctor? I don't think he's going to make it." I remember asking her what had happened, and she said he wanted it all to be over, and he just stopped responding. I turned to see his heart rate steadily decreasing on the monitor. The doctor was in the room for not only a minute, and he came out, and I asked him if there was anything that I could do, and he had said, "Nothing, he's already gone." I think in that moment I just blankly stared, not knowing what to do or what to say. My thoughts immediately went for the patient's wife and son, who were also patients within the hospital, and the nurse who had just got impacted by this situation. Although he chose his time to go, it doesn't make the situation any easier. A lot of tears were shed that night. He may not have been my patient, but it's something I will always remember. Remembering not every story has a happy ending is hard as a nurse, but I strive to give my patients the best possible outcome every day.